A 7-year-old pug stops after a few minutes of walking, struggling to catch its breath. The persistent coughing and exhaustion look like end-stage illness. In veterinary cardiology, severe exercise intolerance and chronic respiratory distress point to two distinct, highly lethal conditions: Stage C mitral valve disease and Class 3 heartworm infection. Treating a dog based on these outward signs alone is a gamble. Administering the protocol for one condition when the animal actually suffers from the other will cause immediate, fatal complications. The same labored breathing and lethargy hide two completely different biological wars happening inside the chest. In coastal Indian cities like Puducherry, the local climate and breed demographics make this diagnostic overlap a daily reality for veterinary clinics. Veterinarians frequently evaluate aging, small breed dogs like the Spitz and the Pug, arriving with these exact signs of acute respiratory distress. To accurately diagnose the cause, clinics must rely on echocardiograms and thoracic radiography to peer past the symptoms and examine the interior of the chest. The imaging reveals the true nature of the crisis. Saving the dog requires determining whether the illness stems from a structural breakdown of its own internal machinery or an invasion from the surrounding environment. Mitral valve disease is a mechanical failure of the heart's anatomy. It is an age-related, degenerative condition, heavily concentrated in older, small-breed dogs. Using an ultrasound probe, sonographers capture a live digital cross-section of the beating heart to evaluate the interior structures in real time. Over time, the mitral valve physically degrades. It fails to form a tight seal during each heartbeat, forcing blood to leak backward, an anomaly that creates a loud, high-grade hollow systolic murmur audible through a stethoscope. This continuous backward pressure causes the left atrium to swell and permanently enlarge. That structural distortion physically compresses the adjacent airways, resulting in the chronic coughing and rapid breathing seen in the waiting room. There is no cure for this genetic, structural decay. The damage is permanent and must be managed medically for the remainder of the animal's life. Heartworm disease presents identical outward symptoms, but the cause is completely external. It is an invasion by the parasite Dirofilaria immitis. The threat peaks during the Indian monsoon season. Heavy rains leave behind stagnant floodwaters across urban streets, creating ideal breeding grounds for mosquitoes. When an infected mosquito bites a dog, it deposits microscopic larvae into the skin. Over several months, these mature and migrate into the pulmonary arteries, leading from the heart to the lungs. The growing worms harbor an endosymbiotic bacteria called Wolbachia. This bacteria triggers a severe inflammatory response in the dog's lung tissues, severely compromising its ability to oxygenate blood. This internal blockage and inflammation perfectly mimic the exhaustion and coughing of age-related heart failure, yet the entire physiological cascade stems from a single preventable insect bite. Because the biology of these conditions is distinct, applying the wrong medical intervention is disastrous. For mitral valve disease, the focus is physical support. Veterinarians prescribe lifelong medications designed to lower blood pressure and reduce the mechanical workload on the failing heart muscle. Heartworm requires a targeted chemical strike. Doxycycline kills internal bacteria, followed by melarsamine injections to eradicate adult worms. During treatment, strict exercise restriction is mandatory. An elevated heart rate forces dying worms to obstruct blood flow, triggering fatal Cavill syndrome. The clinical path is dictated entirely by the nature of the threat, carefully managing a mechanical decline versus forcefully clearing an active, volatile parasite. Defeating heartworm requires aggressive environmental management, eliminating standing water, maintaining neighborhood vector control, and administering preventative chewables stops the parasite before it enters the host. For mitral valve disease, vigilance means acknowledging breed risks. Scheduling routine cardiac ultrasounds for aging small breeds can detect murmurs long before respiratory symptoms appear. By identifying the exact origin of a respiratory crisis, veterinarians and owners can implement the right interventions to extend a dog's active life.